Hey everyone, Dr. Jagoda here. Today we're going to discuss elbow pain as well as release of the brachialis muscle. So the brachialis muscle is a muscle that lies underneath the bicep here. It attaches to the middle aspect of the humerus and it goes down into the ulna. But it is quite large and it is responsible for elbow flexion but not supination and pronation. So it can be really important when patients are having or when those individuals push or pull and do a lot of elbow flexion, they can end up getting pain underneath that bicep. And it's really common, actually, a lot more common than you think. So a lot of people actually just treat the bicep but forget about the brachialis muscle. So we are going to show you a self-release for that muscle. It's a little difficult to get to under, but nonetheless we'll do it. So the first things first is that you need to release the bicep as best you can so that you can penetrate or get down to that deeper structure. So everything you can do to first release, stretch, get rid of that bicep tension, and then you can move on to the brachialis. So we'll approach the brachialis from two different angles, from the lateral aspect of the arm and the medial aspect. So if you can see this, what we're going to do is we're going to take that muscle. You want to have it in a shortened position. So something like this where I'm at, where my elbow is already flexed, is a good idea. You'll make a quick little muscle, feel the edge of that bicep, and then what you'll do is you'll take your edge of your bicep, you'll flex the arm, you'll push down and in. So you're going to go down and then in, like this, and then rotate. So you'll go down first, in first, and then you'll be on the lateral aspect of the bicep, or to the brachialis. And then what you're going to be doing is opening and extend the wrist as well. Will help with the fascial tension. And then release. And then like that. You can also do this with a tennis ball on the outside, but I find that if you can get your thumb in there or some sort of more focal or localized kind of tool, it's a little bit easier. For the medial side, what we'll do is the same kind of concept. We're going to push down and then push in. So from this position, you'll push down into the bicep, through the bicep, slightly medial, and then you're going to push inward like this. So come in, and this is where I have a lot more tension. You can feel that, and it's actually quite painful here. Oof, and it hurts. And then you're going to go slow, and then come back. Take the tension off when you come back, and then as you come in, you're going to release it all the way down, just like that. Extend the wrist if you can. The wrist extension doesn't really help with the overall movement of that muscle, but rather it helps pull that fascia or pull that connective tissue downward, thus opening up the elbow. Again, you'll start in this position, pushing down first, and then shoving that bicep off to the side, and you're coming right through here, and I can really feel this. And then open up. You should probably do about 3 to 5 passes at least each side, maybe about 4 to 6 depending on the inside, and that'll really help free up that brachialis muscle. Again, you really need to clear out that bicep first in order for you to be a little bit more effective with that brachialis muscle, but really good to help elbow and I guess you could say not only forearm but arm pain as well. Alright guys, give this a try. This should help. If you can't get in with the tennis ball, like I said, try to be a little bit more focal with your fingers or with some sort of smaller tool to dig in there. Alright guys, thanks again for stopping by. I will see you next week. Bye.